Hello there, my name is Frankie O'Shea. I'm an advanced nurse practitioner and I work with the cognitive disorders team based at the National Hospital for Neurology and Neurosurgery in Queen Square in London. Today I'm going to talk to you about cognitive changes in motor neuron disease. Up to 50% of people with MND will experience mild cognitive change, and of these, a further 5 to 10% will develop frontotemporal dementia, which is often shortened to FTD. Cognition refers to a range of high-level brain functions, including executive functioning, language, memory, perception, and social cognition. For people living with MND, the most prominent cognitive impairment is in executive functioning. This includes the person's ability to set and achieve goals, to plan and to problem solve, to respond to new situations, to shift attention or to divide attention between different tasks, and to initiate or to inhibit responses. This can affect the person's ability to manage their affairs and finances, to plan for the future, to concentrate, for example, when reading or dealing with household bills, in undertaking new activities and the use of new equipment or learning new tasks, in holding conversations if background distractions are present, and doing more than one thing at a time, for instance, ironing while watching TV, and being able to adapt to having an illness and making decisions about its management. Some people will also show changes in language and behaviour, but memory is not usually affected, and problems with perception, which is information gathered by the 5 senses, are rarely seen. Changes in social cognition, which affects the person's ability to empathise with the feelings and beliefs of others, may be challenging for carers and family of people with MND. Cognitive changes can be subtle and may be masked by movement and speech problems. Behavioural change. Changes in the way people behave may include egocentric or selfish behaviour, loss of interest, apathy, disinhibition, irritability, aggression, and absence of insight into these changes. People with MND may also find it difficult to recognise emotions in others and have altered sensitivity to social and emotional cues. It's important to note that people with no cognitive change can have profound behavioural changes. Frontotemporal dementia and MND. FTD is a more severe form of cognitive change. The symptoms, many of which are more extreme versions of those already discussed. They could include more extreme, marked executive dysfunction, again affecting planning, decision-making and problem-solving, a change in expressive language. The person has difficulty communicating what they're trying to say, reduced generation of language, impaired use of grammar and language production, word retrieval difficulties. It may also be a change in receptive language. The person has difficulty understanding what's being communicated to them. Behavioural change in MND FTD can include significant personality change, disinhibition and impulsivity, which is socially inappropriate behaviour. Perseveration. This is continuing to conduct an activity that is no longer appropriate. Changes in eating behaviour, for example, sweet tooth preference is classic in FTD, or cramming too much food into the mouth at one time. A loss of emotional understanding, the person may appear egocentric or selfish, being withdrawn, displaying apathy or failure to initiate tasks, and displaying obsessive compulsive or ritualistic behaviours. Behavioural change can occur before cognitive change. Support you can give. Family members may be the first to notice early signs of change. It's important that you listen carefully to what they're saying, as you may recognise potential indicators of cognitive change. If you recognise any symptoms of cognitive change in the person you're caring for, it's advisable to discuss them with the person with MND and, if relevant and appropriate, their carer or family, to see if they're aware of any changes and to explore their thoughts. It's important to rule out other causes. Any changes should be discussed with the person's neurologist and the wider multidisciplinary team. Timely assessment by professionals is important. Understanding the cognition level of the person with MND is crucial to help them and their family cope with what may lie ahead, which includes being able to make timely decisions about treatment and care. You could make use of different tools to screen for potential signs of cognitive or behavioural change. If the result indicates some evidence of impairment, then advice should be sought from local clinical neuropsychology services. The Edinburgh Cognitive and Behavioural ALS Screen tool has been designed specifically as a first step in assessing the presence of cognitive change in MND. It is designed to take about 20 minutes to complete by any health or social care professional. It can be used to screen people to see whether they would benefit from a full neuropsychological assessment. The motor neuron disease behavioural scale is a simple tool used for the identification and quantification of behavioural symptoms in ALS. It measures 3 behavioural domains: apathy, disinhibition, and stereotypical behaviour. The Mini Addenbrook's cognitive exam is a brief and sensitive cognitive screening tool for dementia. However, it is not specific to MND. Thank you.